no more important issue of our time than making sure that individuals who don't have health care have health care. There's no more strategic job creation debate ongoing in our country than to how to make health care more. Why is this governor so at variance with medical leaders, with labor leaders, with community leaders when it comes to issues of health care?
Now, Dan, one argument that her supporters make is that these are tough times, so it's easy to sit on the sidelines and say we want this good thing, we want this good thing, but the state has such a serious multi-billion-dollar deficit that you got to make those tough choices. It just isn't the time to pay for expanded health care. Or what's your response to that?
Well, this is a governor who's never supported expanding health care, so that's quite a disingenuous statement that anyone would be making on her part. With respect to the bills that she vetoed last week, they probably would have been cost savings bills, because the people who are going to lose those benefits presumably are going to sign up, certainly sign their children up for Husky programs, which actually come at a greater cost than the health plan that they had available to them through their agreement. I suppose perhaps the governor is making a calculated guess that the people that she effectively took health care away from last week in vetoing that bill won't show up for a period of time. They won't show up at the emergency room.
Well, do you think
we know that emergency room care is the most expensive way of delivering care in Connecticut.
So the plans in Washington right now, do you support the Senate version that does not include a public plan, the House version that does include a public plan?
Right now, I think we should be taking a serious look at the House plan.
The House plan.
We may need to compromise, I understand that some folks don't think that the federal government should be in direct competition with the healthcare insurance industry, but we do know that the healthcare industry takes about a 19 to 21% cut of healthcare costs, which is substantially higher than the 1%, 2%, and 3% that the federal government gets to recover its costs in federally sponsored programs, veterans, and other programs. There's probably got to be somewhere in between.
So President Obama...
But unless we get to the point where there is some competition with that industry, that's going to be very difficult to do.
President Obama says we do want them to be in competition because that'll drive down costs. Joe Lieberman says we don't want them to be in competition because it'll drive down costs in part by reimbursing doctors too little when they're already not reimbursed enough. It'll be similar to Medicaid rates. Where do you stand on that?
That's the Joe Lieberman of 2008. The Joe Lieberman of 2006 was saying that he did back that plan. So right now I want to see a very serious debate about government-sponsored competition.